Today, the work here is going to draw on the experience and expertise of the networks of providers and other professionals working in the space to reach children without immunization and other services. These conversations have yielded important insights about the challenges and promising practices in order to reach zero-dose children who have never had immunization. And with that, it's my pleasure to introduce the Geneva Learning Foundation, whose names and voices will probably be very familiar to many of you. First up is Reda Sadki. He is the president and CEO of the Geneva Learning Foundation. And then we have Jenny Sequeira, who is an immunization and strategic technical advisor with the Geneva Learning Foundation. And then Charlotte Mbu, who's the acting manager also with the Geneva Learning Foundation. And with that, I will turn it over to you, Reda.
Thank you very much indeed, Heidi and Aaron, for this introduction. So next slide. In about 10 minutes, I'm hoping to provide a little bit of framing before we dig into what we actually learned about identifying and reaching zero-dose children through these ZDLH-X events. And you'll be hearing some remarkable insights and case studies, both from Jenny Sequeira and from the case study authors, zero-dose practitioners themselves. I want to try to give you a sense of the method and the approach that led to these insights. Next slide. So first of all, if you look in the first semi-annual update of the Gavi Zero-Dose Learning Hub, and you'll find this update on zdlh.gavi.org, you'll see this statement: engagement with frontline staff through peer learning is powerful and then can identify what works and how. That, of course, begs the question, is there a reliable, reproducible method by which we can, in fact, lead such engagement to really maximize the insights and get the highest return on this kind of engagement? Next slide. So as an example of the work that we've done as part of the Gavi Zero-Dose Learning Hub, this series of 2 ZDLH-X events, which were really events focused on sharing of experience between zero-dose practitioners, as you'll see from all levels of the system. Within 6 months, we grew a community of zero-dose practitioners from 0, as the ZDLH was completely new, to over 3,000. And you can see that not only the 4 country Learning Hub countries were represented through this process and joined and showed interest and contributed, but also, in fact, zero-dose practitioners from 100 countries. And on the right-hand side, you can see, as a point of comparison, a number of platforms which include some type of focus on zero-dose and the level of participation, both from the specific ZDLH countries and the total participation. So in 6 months, this is the numbers we were able to reach. Next slide. Now, the next question is, well, okay, are we reaching the right people? So with the ZDLH-X, you'll see that we reached 37% subnational, really district and local. You can see there's almost a quarter of the participants who came from the region or state level. A little bit over a quarter are actual national EPI planners also participating and contributing, and then 13% internationals, and 85% involved in zero dose. Next slide. So it seems like we've reached a fairly significant number of people directly involved in zero dose from all system levels to participate, to engage through peer learning and identify what works and how. And this, in a way, is the forest. This is a big picture. Jenny will be looking with you and taking you through the individual trees, specific case studies, and to see what exactly can we gain from this type of process. So the next question is, how did we do it? So at the Geneva Learning Foundation, we've studied the culture of immunization, and ran in 2020 and 2022. We performed 2 large-scale measurements and found that across a range of dimensions of actions, continuous learning is really the Achilles heel of how we learn in immunization culture. What that means concretely, you can see 5 specific things. 1 is relatively few learning opportunities. 2 is just limitations on the ability or for staff to experiment, to take risks, and with that comes a low tolerance for failure. Number 4 is a focus on task completion at the expense of developing capacity for future performance. And 5 is that lack of encouragement for learning. So this, we knew that if we wanted to foster learning about zero dose in order to better understand how at the local levels we identify and reach zero dose children in under-immunized communities, we needed to tackle this continuous learning dimension. Next slide. So at the individual level, we know a lot from the learning sciences about how to strengthen continuous learning. And so in reviewing these 6 ways in which we know we can strengthen continuous learning, we asked ourselves, well, how do we develop the ZDLH-X initiative, series of peer learning events within the context of the Gavi Zero Dose Learning Hub, in order to strengthen that continuous learning? And we try to build in all 6 of these ways of thinking, ways of doing, such as motivating me to believe strongly in the importance of translating knowledge into action, or number 6, helping practitioners identify and overcome workplace obstacles. So through every step of the process, as we developed with the Zero Dose Learning Hub, with Gavi, the design of the ZDLH-X, we asked ourselves, how can we actually make sure that the way we're doing it is going to be conducive to fostering continuous learning? Next slide. Now, across 4 phases of ZDLH-X, I want to first highlight that the second, the yellow bar, the experience, is actually the live event. But in fact, most significant learning through the ZDLH-X process does not happen during the live event. It is the most significant amount of time commitment that we ask of participants, 90 minutes, but it's actually the component of ZDLH-X that precedes and follows this experiential live event where we find most of the significant learning happening. And that goes to with the level of effort required for our team, for ZDLH, to analyze the incoming data as hundreds of practitioners share their zero dose experience, and after the event, share their reflections on what value this has created, what did we learn, and what are you going to do differently as a result? And then most amazing is that the knowledge translation piece, staying connected with fellow practitioners, figuring out what to do with what you learned, becomes a kind of self-sustaining cycle. And so a big investment upfront in terms of the level of effort required to set up and establish such a system, but really the benefit of peer learning is the potential for it to be self-sustaining. Next slide. This is just, for those who wish to know more, a paper about that process, really bringing together, in order to strengthen continuous learning, which we know is the weakest part of how we learn in immunization, is really combining peer learning, remote learning, social learning, and network learning in order to foster, to build an effective learning system. Next slide. So of course, the following question is, okay, does this actually make a difference? And here this is where we talk about measurement. Next slide. So we actually, in ZDLH-X, we proposed a way to measure for individuals the creation of value in this intervention that can also be used in other types of interventions. So this, we looked at and we asked questions: has this changed you as a professional? Has this changed your social connections? And so on. And we had a baseline from 2022 with over 10,000 immunization responses from immunization professionals, which then enables us to show, for example, that on most dimensions, ZDLH-X as an event actually created more value than our baseline. And compared to other studies, this is a very high, this is just overall a very high level of value creation through peer learning. Next slide. Next is the question of how effective learning relates to performance. So of course, in this case, ultimately, it's about what we would call in education or learning science terms, mission performance, in immunization terms, improved vaccination coverage. And here we find, and this is the amazing part about the dimensions, the different ways to learn, is that we know that if we strengthen these different ways to learn, we can show that there's a strong correlation between improved learning and improved both knowledge performance and mission performance. You can see the effects here mapped across over 6,000 respondents. This is before the ZDLH-X, but the same results apply. So what that means is actually a remarkable insight. Rather than having to demonstrate and prove that that improved learning leads to improved performance, we have a very large-scale study, as well as many other studies in areas other than immunization that consistently show the same thing. If you strengthen the different dimensions of learning, and especially if you focus on the weakest ones, you're likely to get a significant return on investment in both knowledge performance and mission performance. Next slide. So this is my final slide, is really when we think about what we did with ZDLH-X, and as right before we deep dive into the specific cases, insights, and what we actually learned that is likely to be of interest to technical specialists working on zero dose, the way we were able to so rapidly build an effective learning system is by combining three things. One is having a sense of the capacity for change, the environment, and identifying this continuous learning as the weakest dimension of it and targeting that dimension specifically. Second is making sure that we're creating the highest value possible for individuals and teams. And third is, of course, linking that back to actual health indicators, and then exploring to what extent that we can talk about attribution or contribution. My final slide is a kind of emblematic quote that really stood out for our team. Next slide. And it's this one: in response to the new strategies, I learned, this is an individual participant, from the Gavi Zero Dose Learning Hub, we are making a change. We're adapting the practices on top of the existing ones in our district. And then examples of very specific practices demonstrating, connecting the dots between the learning intervention and an actual change in practice that leads to a change in outcomes. Now we're going to deep dive from the forest into the trees with Jenny Sequeira. Jenny, over to you.